On December 14th, 2012, a troubled 20-year-old Adam Lanza shot and killed his mother Nancy before traveling to Sandy Hook Elementary School in Newtown, Connecticut. It was there that he fatally shot 20 school children and 6 adult faculty members before fatally shooting himself as responders arrived on the scene. The nation was shaken by this terrible tragedy and began to ask, who was this troubled young soul, and what could have possibly motivated him to commit such a brutal and horrific crime against innocent school children and faculty members? It was later discovered from friends and family that Lanza had suffered throughout his life with autism and specifically Asperger syndrome, an inhibiting social disorder that can greatly affect one's personal identity and view of society as a whole. The purpose of this essay is to explain the actual disorder of Asperger syndrome, including its classification as a mild form of autism, what causes the disorder, if and how it can be treated, and what we can do to better communicate with those who are suffering from the disorder. Asperger syndrome is an autism spectrum disorder that causes significant complication and difficulties in social interaction, coupled with repetitive and restricted patterns of interest and behavior, and can have a profound effect on construction of relationships and personal identity. Last but not least, the purpose of this informative speech is to better understand those with the disorder and how communication obstacles associated with it can be overcome in order to communicate with the victims. Asperger syndrome is classified as one of the autism spectrum disorders, or pervasive developmental disorders, that are characterized by abnormalities of social interaction and communication that pervade the individual's functioning and by restricted and repetitive interests and behavior. According to the World Health Organization in 2006, like other psychological developmental disorders, Asperger syndrome begins in infancy or childhood and has a steady course without remission or relapse. This causes a severe crippling effect throughout maturity and as the brain develops. In characterizing the disorder and social interaction, the disorder is classified socially by intense preoccupation with a narrow subject, one-sided verbosity, and restricted prosody and physical clumsiness. There is also a lack of empathy, failure to develop friendship and other close, meaningful relationships, and one-sided, interest-driven speech are all often common characteristics socially of the syndrome. Aside from these effects within interaction, we can also characterize Asperger syndrome as a lack of communication whatsoever. We usually see people with Asperger syndrome who are actually afraid to communicate with other members of society. This fear is often quite irrational, and people without the disorder are usually confused as to what causes such an immense fear for other members of society and interaction with such. In studying what causes Asperger syndrome, there is no specific gene that has been identified. Research supports that common symptoms of fathers with Asperger syndrome have been passed on to children with Asperger syndrome as well. However, there is no repetitive gene that scientists can identify yet to classify the disorder. Most research suggests that all autism spectrum disorders have shared genetic mechanisms, but Asperger syndrome may have a stronger genetic component than autism, according to McPartland and Klin. Environmental factors have been hypothesized to act after birth, but has not been proven by scientific research. Asperger syndrome can be diagnosed in many ways and is usually diagnosed by a behavioral therapist. A general diagnosis set of criteria for Asperger syndrome includes impairments in social interaction, as well as repetitive patterns of behavior, interests, and activities, without a significant delay in language or cognitive development. It is important to note that victims of Asperger syndrome usually show no signs of retardation whatsoever in terms of speech or general daily functions. It is only an immense fear for social interaction. According to the American Psychiatric Association, U.S. criteria also require significant impairment in day-to-day function. This can mean socially or physically. In the last quarter century alone, increasing popularity of drug treatment in the Western world has led to acute overdiagnosis of the disorder, and sometimes even a misdiagnosis as ADHD or ADD. Concerning the management of Asperger syndrome, there is no medication that directly treats the core symptoms of Asperger syndrome biologically. Mild medical approaches, such as mild serotonin inhibitors, are often associated with intense behavioral therapy, and that can sometimes lead to a prolific effect of social interactions and personal identity alike. In conclusion, Asperger syndrome is an acute form of autism, meaning that although such a disorder can cause significant attributions of undesirable social and personal qualities, it is a psychological disorder and is mostly involuntary. It can easily be misidentified as poor social skills or an unwillingness to communicate, but stems from a much deeper disorder associated with autism. Although there is no specific cure for autism or Asperger syndrome for that matter, and no medication to directly treat all aspects of the syndrome, medication coupled with behavioral intervention therapy can aid in increasing inhibiting effects of Asperger syndrome and can drastically increase personal relationships and self-identity. Patients with Asperger syndrome are able to participate in social interaction in normal life, but not without great obstacles required in order to mimic functioning social qualities despite the disorder. It is for that reason and for the purpose of this speech that we must factor in these obstacles that are associated with the victims and use that as information to develop better communicative strategies with such people.